Hello, this is hashtag #ArthurLaspy, and my name is Robert, and I live in North Queensland. And I want to make this to show you what melanoma is like. This is not the first melanoma operation I've had, and you can see from the size of the graph there how much they had to take off the side of my face there. You can see from that one there that these things can get very invasive. You get the same treatment as you would with a woman who has breast cancer. I was in hospital for 2 hours 45 minutes in the radiation clinic, the nuclear medicine, which unfortunately did not find where the cancer was spreading to. The dye failed in me, it does in some people. So the surgery's gone ahead. Whether or not I've got further invasion will be found out. But I wanted just to say to you, as a person with autism, how I'm dealing with this. One, be assertive. I will not stay in hospital. I just don't like nurses. I just find it difficult to understand them, and they don't understand me. So I insist on day surgery. So my day started at 3:30 a.m. in the morning and didn't finish until about 4:30 in the afternoon. The surgeons were pretty good because they understood that I was on the autism spectrum, and I began to stim on the operating table before the anaesthetic was put into me, and I was shaking, and they had the common sense to leave the room and wait until the necessary surgery was to take place. Now, I'm not going to go into reasons why I've got melanoma. I live in Queensland, Australia. You can look up the statistics of it. I'm an old man, I'm 67 in a few days, and it's surprising not to have something major happen in your life. I've had several problems, and melanoma is just one of them, but it's not my first. I've had 3, and I'm going on to a 4th one. The surgery is not nice. I did not want to have a graft, but I had no choice in that. So there will be scarring, as you can see the type of scarring I have on my chest there. But I've got other worse scars in my back, which I'm not going to show you. I was a victim of violent crime when I was younger, so I've had the full 4 economy. Behind me you'll see some of the paintings I'm doing in my painting challenge, because I'm in a period of my life where I need some peace, I need some time, and I need some quiet, so I'm doing this challenge, and it's just for myself. Some people will like the paintings, some people will hate them. They range from quite abstract to expressionistic, and I just hope that you'll come and visit and have a look. As far as needing sympathy or whatever, no, I don't need that. Platitudes, keep for the end of the world. I think that people overplay the sympathy thing a bit, and if you can just empathise and just understand that ageing is no fun, and add autism to it, add a chronically bad disease to it, you're going to have some problems. So make sure that if you're in the same situation, that you stand up for your rights. Tell them you're on the autism spectrum. Tell them what they need to expect. Make certain they understand all that. Understand that certain chemicals, for example, I could not sleep. This happened a couple of days ago. I could not sleep for about 40 hours after the operation, because the chemicals that they use just light up my brain. My brain just goes quite strange. I can't cope with all of it, and I was just very pleased. Make sure you have someone to pick you up and take you home. I don't have a family to support me. I don't have any long-term friends other than people who I've known for years on the phone and the like. I have a live-in housemate, and that helps a great deal. But other than that, you know, my world is pretty isolated, and YouTube is just one way of me showing what I can do. So thank you for viewing this and understanding that I hope that aging with autism is not easy. It doesn't improve in certain ways. I'm intellectually okay in many respects, but I will stim. I will react to people if they're rude to me or indifferent, and you know, there are reactions to the whole thing. Okay, I have my stitches out on the 14th, and we'll just see how it goes from there. I see my other specialists after towards the end of the month to see about this 4th melanoma, and we'll just go from there. Thank you, and please visit my channel and have a look at my fast painting challenge. Thank you.